Lifecare IVF is offering sperm DNA fragmentation test. We thought this is the right time that people like you should know about the sperm DNA fragmentation test. As we all know that 15% of the population is an infertile population and male contributes in almost 50% of cases. The only test which we have been doing till now has been examination of the male partner and the semen analysis. But I think there are a lot of tests which need to be done beyond semen analysis.
We have to understand that poor semen quality is responsible for less than 10% of the pregnancies. If you do have a poor semen quality, we will not get a success rate more than 10%. We also need to understand that the integrity of the sperm genome is very essential to get a healthy baby.
This sperm DNA fragmentation test is only a test which is done to find out whether there is increased number of DNA fragmentation is there. Now the cutoff in various labs which has been worked out is if the DNA fragmentation index is less than 15, it is termed as normal. If it is more than 25% DNA fragmentation index is there, then there is a chances that sperm this fertilization does not take place at all. Now, Dr. Parihar, will you tell what are the indications for DNA fragmentation test?
Yeah, indications for DNA fragmentation tests are like unexplained infertility, poor semen parameters, multiple previous IVF failures, or recurrent pregnancy loss, or
even for that matter, recurrent IUI failures also.
Yes, recurrent IUI failures, or male partner suffering from varicocele, or in other cases also where there is occupational hazard also. These are the cases where we should refer the patient for DNA fragmentation test.
Now, what is the test which we are doing in our lab?
At Lifecare Center, we are performing sperm chromatin dispersion test. That is our main test.
And it's a wonderful test. The test takes about 1.5 hours, and we give at the end the slides which we have prepared for this particular patient, so anybody can go and show it to the other doctor. So the test is available. The only thing is, what do we get out of it? Once we get the sperm DNA fragmentation test is positive, then we feel that the IUI does not work, the IVF does not work. The only thing which works is an ICSI in such patients. And once the patient comes to know about, the couple comes to know what is their cause of recurrent miscarriage, what is their cause of recurrent IUI, IVF failure. So they exactly come to know the answer about it. It's a lovely test, and more people with this kind of problem should definitely get this particular test done.